is a urea cycle disorder. OTC, what is called OTC? Or ornithine transcarbolysis deficiency. It affects the urea cycle. So you see how many enzymes, even one small enzyme defect will be lead to the biggest problem in the baby. Mainly it will be affecting the survival is affected because it is affecting the metabolism. So what's happening? Poor feeding, normal person, it is excessive, means it is deposited in a form of fat. Again it will come back to the cycle and give energy. But this is very abnormal. It is also mainly they are telling it's a genetical disorder. Poor feeding, irritability, lethargy, vomiting. Most commonly you are seeing all these things. Why? Because of the deposition of these excessive amount. When they cannot break down, all these deposited into the main organs, blood vessels and other things. So this is the one is causing the headache, nausea, psychological changes, irritability, the tender tantrum, many things you can see the common defects. Mainly the defect in the enzyme or ornithine transcarbonase, which is responsible for converting the ammonia to the urea to the liver. Converting the ammonia to urea in the liver. So what's happening? You cannot convert when this problem of this enzyme. So an X-linked disorder, meaning it is carried in the X chromosomes. That's why it's called the X-linked disorder. Main treatment is a hemodialysis to remove the toxins from the blood. Otherwise what will happen? It will be going and depositing main organ. That is a non-protein high caloric diet you will be giving. Protein restrictive diet you will be giving. Liver transplantation need to have to do in a very severe condition. Next urea cycle disorder is called the arginosuccinate lysate. It affects also urea cycle. How it is affecting the urea cycle? Here main causes is the mutation in the ASL gene that prevent the body from producing the enzyme ASL. So what is ASL? This enzyme, the arginosuccinate lyase. This, so it's affecting the urea cycle. So what's happening? When it is not able to convert by this enzyme, this hyperammonia level will be increasing because it cannot, the function is affecting the breakdown of this one. So naturally it will be lead to lethargy, vomiting, excess level seizures, coma and the neonate it will go. Complications, liver dysfunction and neurocognitive defect and the hypertension and the epilepsy. Next urea cycle disorder, triple H syndrome. The triple H syndrome is called the hyperornithinemia and the hyperammoniemia and the hemosibiruria. So this is a rare inherited metabolic disorder mainly caused